You usually associate altering your physical anatomy with, like, clearing your entire calendar.
Oh, absolutely. Arranging for a ride home, going under heavy anesthesia.
Right, and basically spending 2 weeks straight on the couch recovering.
Yeah, that's the traditional assumption.
But what happens when reconstructive, highly intimate procedures suddenly take less time than your actual lunch break?
It completely changes the game.
It really does. Welcome to this deep dive, where today we are looking at the medical reality behind a fast-tracked appointment that is, well, quietly replacing major surgery for a huge demographic.
And we have a really fascinating, highly specific stack of sources for you today.
We do. We're pulling from clinical cosmetic guides, medical spa brochures, and even comprehensive safety consensus reports from the American Society for Dermatologic Surgery.
Right, and all of these materials center around a rapidly growing procedure known as labial puffing, or labia majora augmentation.
Exactly. So the mission for this deep dive is to demystify the biology behind why so many women are seeking this out. And most importantly, we want to answer your highly focused question, which is exactly how long does a labial puff appointment take from the minute you walk in to the minute you leave?
It's such a great question because this is an area of aesthetic and functional medicine that is expanding at an incredible rate.
Yeah, but nobody talks about it.
Exactly. Because of the anatomical location, it operates entirely under the radar. I mean, people just aren't discussing vulvar reconstructive timelines at casual dinner parties.
Definitely not.
But to truly understand the physical timeline, like why one method takes 15 minutes and another takes almost 3 hours, we have to look at the underlying cellular breakdown first.
Okay, let's unpack this, which means we are starting with a why before we actually run the stopwatch.
Right.
Because the source stack reveals a statistic that honestly it caught me completely off guard. Roughly 40% of women notice significant intimate anatomical changes as they age.
It's a huge number.
It is. And it's incredibly easy to assume this is, purely a cosmetic trend, like some certain societal hyperfixation on how every square inch of the body looks.
But the clinical data points somewhere entirely different.
Totally different. A massive 52.2% of women seeking this enhancement are doing it to fix strictly functional issues.
Yeah, and the literature actually uses the term sports vagina to describe it.
Which is just wow.
Right. What's fascinating here is that specific phrase completely recontextualizes the conversation. We are moving away from visual vanity and looking directly at biomechanics.
Okay, so break that biomechanical shift down for us. What's actually happening?
Well, as women age, or specifically as they enter perimenopause and menopause, there is a systemic drop in estrogen.
Right.
And estrogen receptors are densely packed in the vulvovaginal tissue. They actually dictate collagen synthesis and the production of mucopolysaccharides.
Which are, wait, what are those exactly?
They're essentially the molecules that keep the tissue thick and hydrated. So when that estrogen plummets, the extracellular matrix of the labia majora, the outer lips of the vulva,
It just shrinks.
literally shrinks. It atrophies. And you also compound that cellular deflation with mechanical stressors like pregnancy, childbirth, or even significant weight loss.
So it's essentially acting as a biological shock absorber.
That's a perfect way to put it.
Without that estrogen maintaining the structural collagen, the tissue acts like a deflated tire. You're suddenly just riding on the rim.
Exactly.
So every step a woman takes, every pedal during a spin class, or, I don't know, every time she gets in a saddle for horseback riding, it creates this brutal bone-on tissue friction because that natural pneumatic cushion is just gone.
And that friction causes severe chafing, micro tears in the skin, chronic inflammation. I mean, it's painful.
I can imagine.
The labia majora are designed to act as a protective barrier for the more sensitive internal anatomy. When they thin out, high-impact workouts or even just wearing tight athletic leggings become functionally intolerable.
Wow.
So you see, the clinical goal here isn't necessarily aesthetic perfection. It is literally to reinflate that biological shock absorber.
We are talking about injecting volume back in.
Yes, right back into the extracellular matrix to restore that protective cushion and stop the mechanical friction.
Okay, which brings us directly to the logistics and your core question about the timeline.
The actual appointment.
Yeah. If you are dealing with this daily friction and you want to reinflate that tissue, how much of your day is actually going to be eaten up by the clinic visit?
It's the big question.
Because anytime we talk about medical intervention, I mean, the baseline assumption is hours of your time. A standard dental cleaning takes an hour. But the sources reveal a completely different reality for the most common method of labial puffing, which uses hyaluronic acid dermal fillers, specifically brands like Deserial or Juvederm Voluma.
Right, the HA fillers.
Yeah, so let's look at the exact quotes from the clinics in our stack. Elite Aesthetics clocks the procedure at less than 15 minutes.
Which is mind-blowing.
Center for Surgery estimates 20 to 30 minutes. And Body Concerns and Injectual estimate anywhere from 30 to maybe 60 minutes max for the entire visit.
It is the ultimate expression of the modern lunchtime tweak. I mean, the sheer speed of the intervention is the primary reason the popularity of this specific treatment modality has just skyrocketed.
Hold on, 15 minutes. I mean, I spend longer than that looking for parking at the medical center.
I know, it sounds crazy.
How can a practitioner safely alter human tissue, avoid major arteries, guarantee symmetry, and actually complete a procedure in the time it takes to drink a cup of coffee? This just sounds dangerously fast.
No, I completely get that. It sounds rapid when you think of it as surgery, but the clinical breakdown of those 15 to 30 minutes reveals a highly, highly optimized process.
Okay, walk us through it.
Well, the actual active intervention time is mere minutes. The appointment starts with the application of a topical numbing cream or a swift local anesthetic injection like lidocaine.
Okay, so that takes a minute.
Exactly. The practitioner waits a few minutes for the sodium channels in the local nerves to be blocked, rendering the area numb, and then they introduce the filler.
And since we know the vulvar region is highly vascular, I imagine the tool they use is totally non-negotiable.
Oh, entirely.
Because the sources mentioned microcannulas. I mean, using a standard sharp hypodermic needle in an area with that many blood vessels, that would just guarantee massive hematomas and internal bleeding, wouldn't it?
Absolutely. Which is why the shift to microcannulas is absolutely critical for this timeline.
What's the difference structurally?
So a cannula has a blunt, rounded tip. Instead of slicing through the tissue and severing capillaries like a sharp needle would, the blunt tip physically pushes blood vessels and nerves aside as it glides through the subcutaneous layer.
Oh, wow. So it just nudges things out of the way.
Exactly. This drastically minimizes tissue trauma, bleeding, and the subsequent bruising. The practitioner creates one tiny entry point with a standard needle, slides the blunt cannula in, and just fans the hyaluronic acid gel throughout the labia majora.
And then they just shape it.
Right. After the injection, a firm, gentle massage is applied to mold the gel. That ensures a smooth contour without any palpable lumps.
Okay, that definitely explains the lack of surgical trauma.
Yeah.
But the real reason the clock stops so quickly is the biological nature of the filler itself, right?
Yeah.
Because hyaluronic acid is essentially a long chain of sugar molecules, and the cortisate is intensely hydrophilic.
Right. Hydrophilic meaning water-loving. It acts like a microscopic sponge. The moment that hyaluronic acid is injected into the labia, it begins attracting and binding to water molecules in the surrounding tissue. It can actually hold up to 1,000 times its weight in water.
Wait, really?
Of course.
1,000 times?
Yeah. This means the volume correction isn't something you wait for. The tissue swells and plumps instantly, right there on the table.
Oh, so there's no waiting around for it to activate.
None. There is no waiting for the body to mount an immune response or build new collagen over weeks. The numbing sets in, the cannula glides in, the HA binds to the water, the volume is restored, and the patient just walks out.
That perfectly justifies that 15 to 45-minute window. But there is a physiological catch with these hyaluronic acid sugar chains.
There always is.
Your body possesses natural enzymes that gradually break them down. The sources are extremely clear that this is a temporary fix. It lasts anywhere from 6 to 18 months before the friction and deflation return.
Right, it's maintenance.
So what if you are just tired of booking a 15-minute appointment every year? What if you want a permanent anatomical fix?
Then you are abandoning the quick filler route entirely. You're moving straight into surgical territory with an autologous fat transfer.
Okay, and how does that change things?
It drastically shifts the timeline we are analyzing. You jump from a 15-minute calendar block to a dedicated 1 to 2.5-hour surgical procedure.
Wow.
Yeah, and that depends on the specific clinic's protocols and obviously the patient's anatomy.
So we are jumping from 15 minutes to upwards of 2.5 hours. I have to assume that massive time inflation isn't the injection phase itself, right? It's the logistics of sourcing the material.
Exactly.
Because you can't just pull human fat off a shelf in a syringe like you can with HA filler. They have to surgically extract it from your own body first.
Precisely. The fat transfer timeline is segmented into 3 distinct, time-consuming stages. First, the surgeon performs microliposuction.
Where do they take it from?
They have to harvest fat from a donor site with dense, viable adipose tissue, typically the inner thighs, the abdomen, or flanks. They infuse the donor site with tumescent fluid, which is a mix of saline, epinephrine to constrict blood vessels, and lidocaine. Then they manually extract the fat. That step alone can take 30 to 45 minutes.
And then comes the processing stage, which the sources highlight as a massive variable in both time and success rate.
Oh, huge variable.
They mention sterilized closed-loop systems like PureGraft. I assume they aren't just like rinsing the fat off in a sink. There is a complex cellular filtering happening here.
Right. It operates on principles similar to dialysis because the harvested material in that syringe isn't just pure fat. It is a chaotic mixture of intact fat cells, free lipid oil from cells that burst during the suction process.
Because it's a harsh process.
Very harsh. Plus blood and all the tumescent fluid they just pumped in. If a surgeon were to inject that raw, unprocessed mixture directly into the labia, the free lipids and dead cell fragments would cause massive inflammation. Yeah, oil cysts, calcification, the body would attack it. So the PureGraft system uses specialized filtration membranes to wash away the blood, oil, and fluid, isolating only the healthy, intact, viable adipocytes.
That makes sense.
Preserving the delicate cell membrane of the fat cell is quite literally the only way it survives the transfer.
Which leads us to the third stage.
Hmm.
Injecting that highly purified surviving fat into the labia majora. But I noticed a mathematically counterintuitive quirk in the clinical guides regarding this final step.
The over-injecting.
Yeah. The surgeons intentionally over-inject the fat. They purposely make the labia much larger than the patient's actual goal size.
It sounds weird, but it is a calculated necessity governed by the biology of angiogenesis, which is the creation of new blood vessels.
Okay, how does that play into it?
Well, when you move fat cells from the abdomen to the vulva, they are completely cut off from their original blood supply. They are essentially holding their breath.
Oh.
In their new location, they have to survive by absorbing ambient nutrients through diffusion, just long enough for the body to grow new capillaries and connect them to a fresh blood supply.
And I imagine a lot of those cells simply starve before that new plumbing can be built.
Exactly. The universal rule in autologous fat grafting is a 30 to 50% reabsorption rate.
Up to half.
Up to half. Up to half of those transferred cells will die, be metabolized, and just be flushed away by the body's lymphatic system in the first few months.
Wow.
So the surgeon has to treat the labia like a leaky bucket. They mathematically calculate that massive cellular die-off, intentionally overfilling the tissue by 30 to 50% right there on the operating table.
So it looks too big at first.
Right, but once the initial swelling goes down and the non-viable cells are reabsorbed, the permanent surviving fat cells leave the patient with the exact proportionate volume they originally asked for.
It is a fascinating biological balancing act. But it perfectly explains why you were on the table for 2.5 hours instead of 15 minutes.
Absolutely.
Let's look at the clock after the appointment ends, though. Because if you squeeze in a 15-minute filler appointment on a Tuesday afternoon, what is the actual recovery reality when you go back to the office?
Well, for the hyaluronic acid filler, the downtime is practically non-existent.
Really, none.
Almost none. You might experience some localized swelling or mild tenderness, but patients immediately resume normal daily activities.
But there are some restrictions, right?
Yeah, the clinics generally advise a strict 24 to 48-hour hold on anything that generates excessive heat or friction. So no high-impact cardio, no saunas, no hot baths, and no sexual intercourse. But functionally, your life is uninterrupted.
Whereas the autologous fat transfer demands a true surgical recovery timeline.
Yes.
The labial area is going to be significantly swollen and tender for several weeks as those fat cells fight to establish that blood supply we talked about.
Right.
But the sources point out a hidden recovery cost. What's that?
Right. People forget about that.
You aren't just healing the vulva. You're healing the abdomen or the thighs where the liposuction occurred. Patients have to wear a tight compression garment over the donor site for up to 6 weeks just to manage the fluid buildup and help the skin retract.
You are managing 2 separate sites of biological trauma simultaneously, which exponentially increases the postoperative care and the physical downtime.
Now, looking at our sources, we have clinics praising these HA fillers as a 15-minute miracle. But we also have to examine the conflicting medical perspectives impartially.
Of course.
Dr. Courtney Poucher from the Labiaplasty Center of Los Angeles is a prominent voice in this stack. And she actively advises against injecting dermal fillers into the labia majora.
She does.
And when she advises against it, she advocates for a surgical alternative she calls a labia majoroplasty. But wait, I've heard the term labiaplasty thrown around in popular culture for years.
Hmm?
Is she talking about the same standard reduction surgery, or does the majora part fundamentally change the anatomical target?
The terminology here is critical, and honestly, it's frequently conflated. A standard labiaplasty specifically targets the labia minora, the inner lips.
Okay, the inner ones.
Right. It is almost always a subtractive surgery, trimming away excess tissue that is hanging down or causing discomfort. What we have been discussing today is labial puffing, an additive procedure targeting the outer lips, the labia majora.
Got it.
So when Dr. Poucher proposes a labia majoroplasty, she's focusing on those outer lips. But instead of adding volume to reinflate the deflated skin, she surgically excises the loose, redundant skin, pulling the remaining tissue taut to eliminate the friction.
Okay. And her reasoning for choosing surgical excision over a fast 15-minute filler appointment is rooted entirely in the molecular behavior of the filler itself.
Exactly.
Because we established that hyaluronic acid is a sugar chain that acts like a sponge. Dr. Poucher points out that this sponge effect doesn't just turn off once the 15 minutes are over. It remains completely dynamic.
Yes, it operates on an osmotic gradient. The filler is constantly interacting with the systemic hydration levels of your body.
Right. So if a patient eats a heavily salted meal, or they are in the premenstrual phase of their cycle where the body naturally retains water, the hyaluronic acid in the labia majora will pull that excess fluid in.
Yes.
The vulva can suddenly and unpredictably swell, becoming uncomfortably enlarged based purely on what the patient had for dinner or where they are in their hormonal cycle.
If we connect this to the bigger picture, she argues that placing a highly reactive water-binding gel into an area that already experiences significant friction and anatomical variation introduces a level of unpredictable daily discomfort, and surgical excision avoids that entirely.
Which really highlights the vast spectrum of medical philosophies available to you as a patient. You are weighing the rapid convenience of temporary fillers against the predictability of permanent surgical alteration.
Exactly.
But I want to pull us back to the sheer speed of the filler appointment, because I think that 15 to 30-minute window creates a sort of psychological trap. It is so fast and so minimally invasive that it feels casual, like popping into a spa for a chemical peel or something. It becomes incredibly easy for a patient to forget that a cannula is still penetrating the skin and introducing a foreign synthetic material deep into the vascular tissue.
That is a very important point. The brevity of the procedure absolutely masks the medical gravity. Any intervention involving the vascular network of the human body carries inherent severe risks, regardless of how fast the clock runs.
Here's where it gets really interesting. Let's look at the American Society for Dermatologic Surgery consensus report on filler safety. If you were sitting in that chair for a 15-minute lunchtime appointment, what is the absolute worst-case biological scenario?
Well, the most catastrophic risk, though statistically rare in the hands of a board-certified expert, is vascular occlusion.
What happens during an occlusion?
This happens if the practitioner's cannula accidentally breaches a blood vessel and injects the thick hyaluronic acid gel directly into the arterial bloodstream. Or, alternatively, they might inject a massive bolus of filler directly next to a vessel. That creates so much external pressure that the vessel collapses and is just pinched sharp.
In either scenario, the blood flow to the surrounding tissue is immediately blocked.
Exactly. And when arterial flow stops, you have tissue ischemia. The cells in the labia are instantly starved of oxygen and nutrients.
And if they don't catch it right away?
If that blockage is not identified and resolved rapidly, the ischemia progresses to necrosis. The affected tissue literally begins to die and slough off.
That's horrifying.
It is. It leads to catastrophic disfigurement and the need for major reconstructive surgery.
That is the terrifying reality behind the 15-minute time frame. But if that happens, what is the protocol? If the practitioner makes a micromillimeter mistake and blocks an artery, is the damage permanent the second the injection happens? Or is there a way to reverse the cascade?
This is exactly why the medical credentials of the person holding the cannula are paramount. The ASDS report outlines a strict emergency reversal protocol built around an enzyme called hyaluronidase.
Okay, so there is a failsafe.
Yes. Practitioners are trained to watch for immediate critical warning signs during the injection. If they see a red flash, which is a sudden backup of arterial blood into the transparent syringe hub,
They know they hit something.
they know they're inside a vessel. Alternatively, they watch for blanching. If the pink vascular tissue of the vulva suddenly turns stark paper white, it means the blood supply has just been severed.
And the second they see that white blanching, the 15-minute clock on the aesthetic procedure just stops. and a completely different countdown begins.
The cosmetic goal is abandoned instantly. The practitioner must immediately flood the ischemic area with high, concentrated doses of hyaluronidase.
How does that actually save the tissue, though? We know hyaluronic acid is a thick structural gel holding water. Does the enzyme just push it out of the way?
No, it chemically destroys it. Hyaluronidase acts like molecular scissors. It aggressively seeks out the glycosidic bonds that link those hyaluronic acid sugar molecules together, and it just snips them apart.
Just breaks it down on contact.
Exactly. Within minutes of contact, that dense, artery-blocking gel collapses. It is rapidly degraded into liquid water and simple sugars.
Oh, wow.
The physical blockage dissolves, the body's lymphatic system flushes the liquid away, and the arterial blood flow rushes back into the starved tissue, stopping the necrosis right in its tracks. Having that enzyme mixed, drawn, and ready to deploy is a non-negotiable safety standard for any clinic operating in this 15-minute window.
So, to synthesize this entire stack of clinical data and decisively answer your specific question about timelines, if you are looking to treat the mechanical friction and deflation of the labia majora, a filler appointment is in fact a true lunchtime procedure.
It really is.
From numbing to final massage, you are looking at roughly 15 to 45 minutes, utilizing hydrophilic sugars to create instant volume with virtually zero downtime. But if you demand permanent autologous results using your body's own fat, you are trading that 15-minute slot for a 1 to 2.5 hour surgical commitment, complete with liposuction, closed-loop cellular filtration, intentionally overfilling the tissue to account for cellular death, and a multi-week recovery for both the vulva and the donor site.
It really strips away the marketing jargon, doesn't it?
Completely.
It leaves you with a very clear mathematical equation balancing your time, your risk tolerance for surgical trauma, and your desire for permanence versus annual maintenance.
So what does this all mean? It clarifies the clinical choices, sure, but it also leaves us with a profound shift in how we view reconstructive medicine as a whole.
Definitely. As highly intimate, biomechanically altering procedures become as fast and routine as a 20-minute lunch break, how does this rapid accessibility permanently shift our baseline expectations for natural aging?
That's a huge question.
If resolving the biological reality of estrogen loss and structural deflation takes less time than ordering and eating a sandwich, will the lunchtime tweak fundamentally change our societal relationship with the human body?
Right. If anatomical alteration is no longer a massive, life-disrupting event, do we lose the psychological space required to accept our changing physical selves?
It's a deep societal shift.
It really is.
Yeah.
Something to think about the next time you look at a 15-minute gap in your calendar.